What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, September 6th, 2024. If you're new to my channel, this is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. Each day it seems like we learn something new about these viruses, and you need to be informed with what's going on. You need a 15 to 20 minute daily news program that gives you updates on these viruses. That's what I do right here. Want to stay informed with what's going on? Subscribe down below, like this video by giving it a thumbs up, hit that notification bell up above, and of course share these videos with anyone you know, and leave your comments down below. It is a very busy day today. We have a lot of news, we have a lot of data, we have some data which is monthly data that just came in today. Yes, there's a little bit of a surprise. My city, Philadelphia. Yes, I'm back home in Philadelphia once again. You can see here, I'm back in my office, not doing any of those out in the wild updates anymore, at least for the foreseeable future. We're not going to be doing them. But yes, my city did give an update on COVID numbers. We'll get to that in a little bit. And of course, some new CDC data and some new numbers from various different states. Yeah, we have a lot of things to get through today. So starting off with this from BNO News, we have two things from BNO News, and it was hard to decide which one was more important because they're both significant news stories, and I think this one may be fairly important at the moment. U.S. to resume mandatory reporting of COVID hospitalizations. That's right, they are going to begin once again making it mandatory, and that will go into effect on November 1st. Now, this second news story from BNO News literally just came to my attention, well, it just came out a little bit ago, right before I was ready to start today's update, and I think you do need to hear about this. This is pretty significant. Limited details at this time. Breaking. Missouri reports human case of H5 bird flu with no known link to animals. Yes, this is very significant. I retweeted this. If you want to read the whole thing that they put here, you can read that over on X. All right, moving on. Like I said, it's very early in the game. Don't know a lot of information. I'm going to be flat out honest with you. I actually have not had enough time to read all this just yet. I literally just it popped up in my feed as I was getting ready to start this video, and I'm like, oh, we need to put that in there. All right, outbreak in Pennsylvania. Pennsylvania is doing really bad at the moment for COVID. This past week, Pennsylvania has really started to go upward. Wastewater is detecting this. And this is not good. This is the VA Medical Center in Altoona, Pennsylvania. I know exactly where this is at. I had a grandfather that had to utilize this VA Medical Center. We're going back well over 15 years now. But yeah, they're dealing with a COVID outbreak at the VA Medical Center in Altoona, Pennsylvania. It's not a good thing. It looks like it's affecting multiple floors. So, yes, we'll have to keep our eyes on this. And in general, this is going to be a bad weekend for Pennsylvania. I'll explain more on that when we get into the data portion of today's update. I also wanted to show you this. Chronic wasting disease. We haven't mentioned it in a while. Missouri reports in 2023 they had a 9% rise in chronic wasting disease cases. Alrighty, let's take a look at the weekly update from the UK. We did not do this yesterday. The UK update this week is kind of mixed. There's some good news, just a hint. A small hint of bad news. They had 1,486 new cases in the past week. That's up by 63, or 4.4%. Now to the good news. Deaths are down by 24%, down by 40. 127 deaths reported. Healthcare, 2,695 people were admitted to the hospital for COVID, or in relation to COVID. And that's down by 455. That's a pretty big decrease. That's down by 14.4%. And you can see here, there's just that very tiny little rise for cases. And then you do see the deaths dropping, which is good as well. And when we come down here to hospital admissions, they continue to drop as well. And if we take a look here, the positivity rate, looks like the positivity rate, it looks like it is below. I think that's the positive. Oh, influenza positivity rate. Excuse me. Looks like that at this time is below 5, and we can see here the emissions. I should correct myself again. This is the emissions for influenza. They're not rising that much at this time. They're still just holding steady at this time. All right, moving on to heat-related illnesses in the United States. There are still a few places in the United States that are continuing to deal with heat-related illness issues. It is really hot right now in Oregon. It's going to be hot for the next couple of days, so we could see this persist for some time. Moving on now to pollen levels. There we go. We got it working today. 39% of the country is in medium to high status. You do see reds from Texas, Oklahoma, portions of Nebraska, portions of Kansas, Iowa, Illinois, even portions of Ohio, extreme southwest Ohio, much of Kentucky, Tennessee, Arkansas, Missouri. You get the idea. Even Colorado has some red at this time. Moving on now to air qualities. Hopefully we'll be able to see this. Let's refresh this. And basically what you're going to see is the West Coast is still doing really bad for air qualities at this time. Take a look at this. Washington, Oregon, Idaho, just really, really bad at this time. If the jet stream should form a ridge out there, which would, eventually push its way to the south or to the east, that air quality, which is bad, would spread back to the east once again. So that is something we're going to continue to have to keep an eye on. Of course, wildfires continue to be a problem out in that area. Want to learn more about climate and weather? You can do that over on my climate spot over on X, Climate Data Report. Moving on now to this, Philadelphia. 781 EMS incidents yesterday, and it does appear that calls for COVID in the city are not rising at the moment. Why? Well, we have the new update, and let's go to COVID-19 trends first. We can see here, if we take a look, it looks like trends for COVID hospital admissions are starting to drop. And on the week of August 25th, 2024, they had 13 admissions for COVID. And you can see here, if you go through all of this, you can see a lot of these, there were quite a few in the summertime. Some weeks did get up to 20s and into the 30s. But for how many EMS calls we had during the summer, it does not appear to be a lot. And also the interesting note is that as this is dropping here, we're also noting that EMS calls in general in the city for most days have now been below 800. So I find that to be really interesting. But there's something else interesting. At the exact same time, something else is going on. Take a look at this. The northeast section of Philadelphia is now seeing, and this has been going on for a while, but it's really starting to accelerate, is now seeing a pretty big increase for COVID at the Northeast Water Treatment Plant. I know exactly where this plant is. I live in the northeast section of the city, so that's not good. Taking a look at the southeast section of the city, we do see there is a little bit of a drop at this time, but southwest Philadelphia, well, that's continuing to rise as well. But again, the biggest rise is being seen in northeast Philadelphia at this time. All right, moving on now, Montgomery County, Pennsylvania. And we do see there are a scattering of calls. There were 3 stroke calls right before I started this video. It's down to 2. Respiratory emergency is in there as well. Taking a look at Chester County, Pennsylvania, we do see heart problems is showing up several times. Sick person, unresponsive person, injured person. Yeah, it's a little busy right now. All right, let's take a look at something we did not look at yesterday, and that is central Pennsylvania. And I do want to show you what's going on. Well, Pennsylvania in general, but also central Pennsylvania. And you can see here, southeast Pennsylvania, we just got Philadelphia today. That's not on this dashboard for some reason. I guess because it only updates once a month. I don't know. A lot of gray in Montgomery County, meaning insufficient data. Last update, we had large increase and increase going on there. York County, Pennsylvania is seeing an increase. Franklin County, Pennsylvania is seeing an increase. There's also an increase in Westmoreland County. And Erie, Pennsylvania is now seeing an increase. Center County, Pennsylvania. Let's pause and talk about this for a moment. Center County, Pennsylvania is starting to see an increase. Can I move myself to the left? I don't know if you'll be able to see this, but I do have this positioned on Center County right now. Take a look at that chart. State College. It's really starting to go up there for COVID at the moment. Moving myself back to the right. I don't know if that actually moved me at all in the video, but the point is this weekend, and we'll move over to my notes now. And here we are. Here's the notes. Football. It's starting this weekend. Now, I was looking at some traffic data earlier. There's not a lot of people headed there right now. It's not the biggest game of the season, but it is the home opener for Penn State University. I believe they're playing Bowling Green this weekend. It's also college football all around the country, and it is NFL this weekend. That could lead to a few more COVID cases. Now for some data about other states. Florida. This is from yesterday, this data. This is a daily update. Florida reported 2,247 new cases and 87 new deaths in their daily update, with deaths including what they would normally have reported for the previous day. Okay. New Jersey reported 2 new cases and 2 new deaths in their weekday update. And New York added another 2,020 new cases. That was yesterday. Virginia, 1,600 new cases added to their cumulative open data page. Puerto Rico, wow. Puerto Rico, another 548 new cases and 3 new deaths added. Alaska is set to return to weekly reporting next week. Here's what they added over the past month. 1,575 new cases and at least 8 deaths over the past month. Georgia, another 6,680 new cases were reported and 25 new deaths. Kentucky, 4,133 new cases. Massachusetts, 2,509 new cases and 16 new deaths. Minnesota reported 1,680 new cases and 17 new deaths. Nebraska reported 838 new positive tests. Ohio reported 10,295 new cases. And there's some good news. We're going to go to Ohio's dashboard in just a little bit. With that, they added another 13 deaths. Utah, 1,265 new people, shown as living with COVID, whatever that's supposed to mean. I'm assuming that means number of people tested positive. And Vermont. This is wow. This is bad for Vermont. 360 new cases, higher than any mark so far this wave, and another 6 deaths in Vermont. Per capita, Vermont's deaths this summer have been absolutely terrible. Let me pause for that on that note for a second. Who remembers when Vermont, during the early days of the pandemic, was doing the best in the country? Yeah, I don't know if we can say that anymore. It's hard to say what Vermont is actually doing now, but compared to the rest of the country, but it's not good compared to where they as a state were back when the vaccine came out, and before the vaccine came out, they were doing much better. Alright, taking a look at Canada, the viral activity level is high for COVID at this time. Viral activity level for flu is low at this time. Influenza B is not detected, and RSV is coming up as low at this time. And we can see here, across much of Canada, we do see levels are moderate to high for COVID activity at this time. Taking a look at Walgreens for this week, 32.2% positivity rate. The prior week was 34.5%. That's a difference of down 2.2%. Total test, 9,667 versus 14,223. It does appear testing is starting to drop, but at the same time testing is dropping, we do note that the positivity rate is dropping. But I express caution on that total number of tests. Why? Look how many white states there are. Any state that's in white is not providing data onto this map. But we do have some reds, we have some greens. Greens are states that are improving. Let's take a look at one. Tennessee, 26.3% positivity rate this week. The prior week was 33.7%. Difference of down 7.4%. Total test, 513 versus 715. Hey, that's a legitimate drop. We also have places that are still rising with legitimate rises. West Virginia, 36.8% positivity rate. The prior week was 24.5%. That's up by 12.4%. Total tests, 57 versus 49. All right, let's move on to some new data from the CDC. Kind of a mixed picture here. First off, wastewater nationally. Yes, take a look at this. Look real close. Wastewater nationally. I can even zoom this in. National wastewater has dropped this week. This is some fantastic news. Something we have not seen happen in quite some time. There was that little mini drop, and then we went up again. So basically we did do kind of a small double peaking, but hey, it is starting to drop. Now for the bad news. There's still only just 15 sites in the United States that are in the very low category for COVID at this time, which means 0 to 19% COVID detected. 74 are in a slightly lighter shade of blue. 248 are coming into that moderate range. And 553 orange sites still in. Still 287 sites that are in the red, which that is a decrease this week. And some of them switched over to the orange this week. We'll have a full wastewater update on Sunday, and you can see here on this map there are still some states that are high, very high at this time, quite a few states. Alright, moving on now to some more CDC data. I don't have the epidemic status loaded up on the screen today, which is fine. I'm going to try and get that back up here tomorrow. We still do have quite a few things that we need to look at. KPE 3.1.1, not updated this week. This is from last week, but that is the variant dominating for COVID at 42.2%. Taking a look at emergency department visits, we'll go state by state tomorrow to at least all the states that have provided data, but overall, take a look at this. It's dropping at this time. So some very good news, but there may be some states out there that are still rising, but there's enough nationally dropping that it's making that national number go down now. That is some really terrific news. Not so terrific news is, take a look at this. Here's the national flu map. Well, tell me something that you're seeing that's new. Yeah, Washington, D.C. Your flu levels in Washington, D.C., District of Columbia, are already up to moderate. So that's rather interesting. And we still do have the low shades showing up down in the south. Right now in Georgia and Alabama and everywhere else is still, for the most part, in minimal. Those are really the only two states that are in the low category. And, of course, the other place being bad, as I just mentioned, is now Washington, D.C., which has made it up to moderate already. So if you live in the D.C. area, maybe you ought to get that flu shot now. Maybe now would be a good time to go out and get your flu shot. And everywhere else, well, start thinking about getting it relatively soon. New Jersey today, 510 hospitalizations being reported. 69 out of 70 hospitals reported. 9 people on a ventilator. 47 people in the ICU. Discharges 79 at this time. New York State reports 2,121 new cases and hospitalizations. Some good news for New York State. 1,096 people in the hospital and 122 in the ICU. That number is dropping. I can feel it within a week or two. I think they're going to finally go below 1,000 hospitalizations once again. We'll see, though. Moving on now, I wanted to show you Ohio's dashboard. And you can see here, look at the 3-week trend. Ohio has finally peaked. Last week was 10,418 cases. This week, 10,295 cases reported. Hospitalizations, they still had another 258. That's the last lagging indicator. Well, actually, the last lagging indicator would be deaths, but it is a lagging indicator. And deaths actually dropped. 13 reported this week. ICU admissions were 13 this week. Moving on now to Los Angeles. We can see in Los Angeles, cases are dropping at this time. Hospitalizations are dropping. Deaths, they're still a little elevated at this time. And testing, take a look at this. The positivity rate actually did start going back up a little bit. We'll have to keep an eye on that. Emergency department visits and wastewater, though, are dropping at this time. California as a whole, the positivity rate for some reason did go up to 13.3% this week. That is up by 1.2%. And yes, this is the update for September 6th. Deaths continue to rise. Influenza at this time is starting to see a slight increase. Nothing major. It's at 1.5%. It's up by 0.3%. And influenza deaths had a slight rise this week. Taking a look at Colorado. Colorado had 146 hospitalizations. And the positivity rate was 15.2%, down by 1.8%. Cases reported this week, 2,594, still high, but down by 211. Taking a look at what's going on in Washington State this week, 2% of emergency department visits are for COVID, 2% of admissions are for COVID, 26 people are in the ICU for COVID at this time, and that is up by 6 compared to the previous week. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We'll have another edition of the Pandemic Update again tomorrow. If you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Friday evening. Thanks for watching.